I'm Becky Fawcett, a mom by adoption, an infertile blonde, a female founder, and a businesswoman. I have to say businesswoman because when you run nonprofits and build a nonprofit, people poo-poo that. They don't think it's a real business. And so I have to say businesswoman because it is indeed a real business. I'm also a reformed perfectionist. I've added that to my resume. And that's actually really important for my story because it all happened when I couldn't have kids the old-fashioned way, which is part of the reason my guest is here today. I'm an outspoken advocate, sometimes irreverent. I think this is what bonds me to my guest. My outspokenness gets me in trouble sometimes. I think she's probably in the same boat, but I won't speak for her. We're going to have a lot of fun today. Today, I'm sitting down with a woman who called me out of the blue many years ago, and someone who supported helpusadopt.org from that first phone call, but really became a friend for many reasons in the long term. She is now in the fight as a female founder and, quote, businesswoman, haha, for women's health and family building. She's smart, very smart. You know, I only surround myself with smart women. She's a pediatric ER doctor, a hilarious author, and an entrepreneur like me. She's also built her family in different ways. She's going to talk about that. And then she looked at a broken thing in the system and said, I'm going to fix it. Please welcome to the show, Lara Zibners. I'm so glad you're here. This has taken a while, but I'm so glad you're here.
You look glamorous as always. I look like I rolled out of bed.
You look great.
Yeah.
Plus, you're maybe not that more exotic than me, but where are you today?
I'm in Vienna, Austria, where it is really hot, and I had to walk outside for 5 minutes, so I melted. And when you walk outside in Vienna, Austria, prepare yourself to get yelled at. So I got yelled at by some people.
Why? That happens in New York too.
Austrians are not happy. They're just grumpy. So if
They
still better, so
isn't it the Sound of Music like Vienna?
No, Austrians don't know what that is.
Oh,
That's not a thing here. That's an American tourist thing. If you go to Salzburg, they don't do sing-alongs.
The hills are not alive, is what we're trying.
The hills are so not alive. The hills are angry. The hills are sad and angry.
Oh my God. Okay, so the first thing we're going to do is talk about, because everybody knows this about me, whether you listen to this podcast or not, you know this about me. I have a story for everyone I know of how we met, and you and I have such a good one. Do you remember it?
I do remember it. I moved to London nearly 20 years ago this summer, and to cling to my American self, I had to do a few things. One of them was to set up a sling box in my parents' den so that I could record Days of Our Lives. And the other one was to pay an exorbitant amount of money to have People magazine shipped to London.
Yeah.
And one day I was reading People magazine, and I think this would have been 2012. I'm reading it, and I flipped to this page. I was probably in the bathroom. Let's be honest. That's the only place you can have a chance to read when you have small children.
Yeah, you have to lock yourself.
I was probably sitting on the old pot and flipping through my People magazine, catching up with my Americanisms. And there was a Heroes Among Us page featuring you and some families that you had built.
Which, you know, I hate that term. I can't stand that term, but I was very grateful for the article. It was a 2.5-page article in People magazine. That's a lot of real estate.
The heroes part or the part that you built?
Heroes. I don't like that term. For myself, I don't like it.
What about the sandwich?
What do you mean? Oh, yeah. But see, I'm from Philly. We call them hoagie.
Not much leaves me speechless, but we're just going to move on from that. Anyway, so I read this article and, you know, I have like ADHD with a touch of like anxiety, and I don't normally pick up the phone and call anybody, but I felt compelled to call that phone number for Help Us Adopt. And I said, hi, my name is Lara. I'm a pediatrician. I am a mother through adoption. And I just saw this article.
Well, you told me, don't judge me. I pay a lot of money to have People magazine shipped to me in London. That was like one of your first pre-qualifiers. And I was thinking, don't judge me because I have a closet full of black clothes and everything looks the same. Like I have my own skeletons like you have with that People magazine. So I felt bonded to you immediately with your level of like open, honest, brash, like who starts a conversation that way? It was great.
Yeah. So I don't even think it was you who answered. I think somebody went and got you, and
Yeah.
then you came on, and I was like, "Don't judge me, but I found this amazing article, and I have a fertility story, and I think what you're doing is cool, and how can I get involved?" And that was
And you also wanted to check me out and make sure I was the real deal, which is
oh, yeah.
something that I want. I'm always, not to get off track, but I am always amazed about people who don't do that with large amounts of money and who they're like, I support X foundation. I go, oh, what do they do? And they're like, I don't know. I'm like, wait a minute, you send that much money to them and you don't know, holy moly. I love when people actually call to make sure I'm like a living, breathing thing. And in today's AI world, you have to do that. And it was great. You really wanted to know, like, how does this
I
work? And
I
what's the
wanted to know,
plan?
and I also wanted to know because I think when you support an organization, it needs to align with your personal
Yeah.
values. And in the world of adoption charity, many
Mhm.
of the existing organizations do not align with
Mhm.
my personal value system. And I think that's what attracted me to you was
Well,
like, look at
that's it. People ask me why it's so successful. And besides, and by it, dear listeners, I mean helpusadopt.org. And part of it's me, I'm the secret sauce, but most of it is the inclusive mission statement. Like, hello, we welcome people. We're talking about families, and families are built in so many ways. And we need to encourage all types of families. And there's so many kids that need to come home. And that was it. There's no judgment, there's no barriers, there's no
yeah, but when
exclusionary practices. And that's
I
novel,
was also
unfortunately.
remember I was living in the UK where adoption is not birth moms make a choice and pick a family. It is some social worker. Literally, I think this was around the time there was some male member of parliament who said we shouldn't be giving epidurals through the NHS
Yeah.
because if you don't feel the pain, you won't bond with your baby. And I was like,
Oh my
oh, well,
god.
I guess I'll just chuck my kids down the stairs then. Because
Mm.
if I didn't birth them out my own vagina, I can't
You know,
possibly
I
love.
had again, oh good, I'm glad we mentioned the V word.
Yes.
You're
I
probably
use
allowed to
it
say
at
it. I
least
don't
3
know.
times a day.
I was laughing because I'm like, I have a list of words that I use in a day that people are like, ew, they make the face. And I know you do
Is
too. And
that
I'm excited.
rectal suppository?
No, yeah, that's your word. Thank God I don't have to say rectal suppository all day long. I could do it. Maybe I'll come moonlight for you. But I say infertility, IVF treatments,
Those are valid.
$5,000 worth of drugs. Well, it makes people uncomfortable, right? And they're just on miscarriage. Holy shit. And now I just cursed on that also makes people uncomfortable. Menopause. I'm in menopause, but that ties back to infertility because 1 in 8 women go through menopause by age 30. 1 in 8 is a big number. No one knows about this. There's so many words I say that people are like, ew. But I
I
like
know.
to talk about these things because A, they're factual words. They're real words. They're not slang. They're real things happening to real
We
people.
learn them in medical school. They
I
are
did not
words.
go to medical school. I got a D minus in biology, just so we're clear. Just so we're clear.
I
Not my
I
thing.
wanted to be a stand-up comedian, but that's really hard. So I just
Mm,
went to medical school instead.
that's funny. That's
But
funny.
secretly, I really wanted to be a comedian.
It's on my bucket list.
One day I will get on stage and I will do my bit. Anyway, so
Okay.
we became friends and that was that. And I think I explained to you, I think probably also part of the interesting thing why you remembered me was I'm not just a mom by adoption. I am a mom by adoption and gestational carrier at the same time. So my daughters at that point, that's why I said 2012. I think they were close to 2. They are 14 weeks and 3 days apart. And so I think when I told you that story, you were like, holy. And I think what you heard there was this is someone like me because she doesn't take no for an answer. She took her checkbook out and beat the holy shit out of infertility all at once,
And
both
let's
kids twice.
acknowledge the reason why you love helpusadopt.org, the same reason I founded it, is you understand that privilege that you had in order to do
That's right.
that and become a mother. And you put yourself for 2 seconds in the shoes of someone who couldn't. And what would that have meant for your life? Right. And that is why that's the same reason I started this. I had help from my grandmother. What would that have meant for my life? So the thing I love about your girls, and this is meant in the nicest of ways, and I hope that is how it is taken by everybody. I don't know which one is adopted and which one is from surrogacy. And I honestly think that's the funniest thing. And I found that funny since we've known each other a long time. The only reason I know Otto as
Yeah.
adopted is because A, he's a boy. He came later and I met him. You were in New York and I met him when he was like a week old.
Yes.
It was so amazing. So that I can remember. But the girls,
And
I'm
that's
like,
because I had met my genetic demon spawn and we decided to adopt. That's the party line. I say it has nothing to do with my genetic child's,
yeah,
attitude or
yeah.
no, it really was. And it really wasn't. It was we chose to do the third one as an adoption because our first adoption was so beautiful and we never wanted our daughter to think that adoption was a booby prize. So my first adoption, both my adoptions were in Florida and my gestational carrier was in California. And so I had to take my 3-month-old out to California and wait for my surrogate to deliver. And then I had to race back to Florida for my final adoption hearing. So when I got to the airport, I had a 6-day-old and a 15-week and something old. And I had them both on my in carrier packs. And I was with my mom and my ex-husband and the TSA lady looked at me and she said, "Are those both yours?" And I said, "They are." And she goes, "Well, how'd that happen?" And sometimes I mess with people and I'm like, one fell out early.
Yeah, exactly.
No, at that point I just said, "Oh, I said one's adopted." And she said, "Which one?" And I looked down and I said,
I don't remember.
and she stopped right there and she said, "I am so sorry. That was so rude. And you just taught me a lesson because it
Well, at
doesn't
least she acknowledged it. Most people are
right?"
like, what? It's like when people say to me, and they don't say it so much anymore because now they know and whatever. But when the girls were little and people would find out they were adopted, my girls, people would go, "How are they adopted? They're so beautiful." And I said, "Oh, see, I told them to throw the children with the horns back." And for those of you listening who are going to write nasty letters to me, I don't really think that. Let's be honest. We know I'm being sarcastic, but this is the thing. Adopted children are just children who come into this world in a different way, and they are beautiful. They are absolutely beautiful, just like any child is beautiful. And then they come into their own and they become even more beautiful. But when the world sits here and goes, "That beautiful child can't be adopted," I'm like, "What are you saying about adoption?" And that's when the bullshit has to stop, right? Now I've cursed twice.
Okay,
But
we're
I get
R-rated
so
officially.
mad with this whole concept of you don't look like an adoptive mother, Becky. And people say you don't look like you work in nonprofit, Becky. I'm like, what is this? There's a look. Did I miss the memo? What are you talking about?
Yeah.
I
You should
explain
hear.
yourself, right? Explain yourself.
My daughter, my first one, had these huge blue eyes. And the thing that was funny was we thought she was going to be biracial, right?
Okay.
And then she comes out with the biggest blue eyes and she's blonde. And I'm like, must have been the other guy. She was so gorgeous that when she was like 3 months old, young men would stop me at Starbucks to be like, "That baby is beautiful."
We have to get back to you and your amazing entrepreneur
Back
thing.
to
But
the-
people think that adopted kids are second best, that they're rejects in some way.
Yeah.
And I am using language that's out there that we hear, that my children are bombarded with, even in today's day and age, of like there's something wrong, which is why you were adopted. Whoever perpetuated that stereotype decades ago, generations ago, is wrong. That was a terrible thing. Adopted people, children and adults, are just that. They came into this world in a different way, and very grown up decisions were made for them without their consent because they were children or babies. And they're amazing, wonderful human beings. And that's just a descriptor, right? It's a biological, it's just like
Just a
descriptor.
I have a friend who is adopted, and she said something very meaningful to me a very long time ago. Because as an adult, she had a great upbringing, has all these siblings, great life, went looking for her biological mother. And it was not a great experience. And I had another friend who also was adopted, went looking for her biological mother, and also did not have a good experience. Her biological siblings had been raised by the birth mom, and they were angry that she got to leave and have a good life.
Oh, God.
Right? But my friend who, the first one I was mentioning, she said to me after she met her birth mom, she said, "You know what? Children of adoption are not the damaged parties. The birth mothers are the ones that have deep, lasting hurt and pain and scars from this." And I've told that to my kids. My oldest is adopted, then my gestational care. And then we decided to adopt very much because our first adoption was such a great experience. And we wanted to make it very clear that we have options available to us. And of all the options that are out there, we're going to choose to adopt your little
Mhm.
brother. And my daughter has never had an issue with it. She's never questioned it. My son, a couple of years ago, it took him a while because he's a boy, right? Girls are
Mhm.
cheese soufflés,
It's
boys are
different.
microwave pizzas. Yeah. So he didn't even get the, like, he would say, Mommy, when I was in your tummy, and I'd say, You weren't in my tummy, buddy. Remember, you were in so and so's tummy. And he'd be like, Right. So when I was in your tummy, he didn't get it for a long time. But when he finally started to get it, I remember him saying, She didn't want me. She gave me away. And we had to
Mhm.
have a very serious, I said, Do you know how badly she wanted to keep you? That was the last thing she ever wanted to do was give you away, but she went and chose a family for you, and we're so lucky that was us, and I'm forever grateful. Children of adoption are not defective. Their birth moms more often than not wanted desperately to keep them, but had life circumstances that made that impossible.
You just reminded me of a story with Brooke, my youngest daughter, who I don't think I've ever told her. So I'm going to tell the world right now before I tell Brooke this story. That's a good mom. I'm going to get that trophy this year for Mom of the Year. I swear to God. But this is a great story and it's fine to tell. I remember when she was little, I don't know, 4, something. She could talk. We were sitting somewhere and she like in the house and she like tried to crawl up in my lap under my shirt. And I'm like, "What are you doing?" And she's like, "I wish that I had grown in your tummy." And I said immediately, I just knew, and I said, "I don't." And she looked horrified, like I had just stabbed her with a fork. And I go, "Are you kidding? You wouldn't be you if you'd grown in my tummy. You would have been a whole different kid. And I love you. I wanted you. I need to see who you become. And if you had, no, it wouldn't have worked. Wouldn't have worked." And she looked at me and I'm like, "You wouldn't be the same kid if that had happened. It would have been a totally different story." And I'm like, "I want your story. I want to see where you go." And that was it. But I get it. It's the same reason why I didn't want to adopt either at the beginning, because I wanted to be like everybody else. And I think when the world tells you sometimes being different isn't cool, now I know it's the greatest thing ever. Being different,
Well,
having is what makes us all great. If we're all the same, it's such a boring picture. It's like, where's Waldo? Like, oh my God,
I
there's
think
no
more people should be
differential.
like you and me, personally. I think we're
Yeah,
pretty
I am
but
unsure everybody would
I
agree with
wanna
that,
I
but
wanna tell a story about that too, but first I have to tell Otto's story. We
yeah.
were at the airport, he was, like, 3, and we're waiting to get board the plane, and I've got 3 children, right? So, Otto was the girls were 3.5 when we adopted Otti, and so now I've got imagine if he's 3, the girls are 6. So I've got 3 children under the age of 7 trying to get on an airplane. Otto crawls between my feet as we're in the crowd getting ready to board. And he grabs my ankles with his head coming out and yells, Push!
Oh, Jesus.
No. And mommy's pelvic floor is better off because she didn't have to. For me, it wasn't necessarily about being like everyone else. It was an element of fear, a fear of the unknown, because you hear these horror stories, right? Oh, well, we adopted and then he stabbed the family, right? Because you got a defective baby.
Well, on
And
Desperate Housewives, remember the kid that murdered people? They're like,
yeah,
"Oh, well, everybody
you
said
don't
that he was adopted. That's why he murdered people." I was like,
right, you
"That's the
don't know
last
his
time I watched that
genetic
show."
it's like a kennel. What's his pedigree, right? And if you don't know the genetics, what are you gonna get? And as a pediatrician, I mistakenly believed that when I had children, I would play a role in shaping them as to who they would be one day. No, they are all born with personalities and they are who they are from the minute they open their eyes and take their first breath. But this fear of not knowing, was that going to be true? What was it going to be like to not have that genetic connection? And it turns out that's nonsense, that all my children are exactly who they have been since the minute they were born. But more importantly, they all consider me mom. There's not 2 of them that go, "Oh, excuse me, adoptive mommy, could I please
Right, right,
have
right,
an ice cream?" Right?
right,
Like, "I'm mom, please wipe my butt. It was a greasy
right.
poo."
But that's motherhood, right? That's motherhood. It's very interesting. So, what you just said. So, as a pediatrician, you would have had specific words to say to a patient if a mother came in and said, I'm adopting this child. Will you look at the chart? I'm worried that I won't bond. You would have said exactly what you knew as a pediatrician. Did you have trouble at the beginning following your own words? Did you have a different conversation with yourself in your head since it was now your reality, not your job?
No. And that's because in my infertility journey, I had reached a point. So, like around cycle 4 of IVF, I started Googling adoption
Yeah.
and
How many did you do? 7?
7. Yeah.
7. It's a lot.
Yeah.
I did
Yeah.
5. It's a lot.
Yeah. It's too many, really.
Did you get pregnant and have miscarriages? I can't remember.
No, I never got pregnant once. There's one thing in my life I've ever failed completely at, and this is it.
So, did I pass that test because I got pregnant 3 times but had 3 miscarriages? I don't see that as I had success. I think I failed
No.
miserably.
But you know what? When you're going through infertility like that, you think you'd give anything just to have had the experience of seeing the 2 pink lines.
I don't think
And
so, because if you want to go through a miscarriage, I would duke you out. You got the better deal than I did, and I'm not
but
kidding.
you well, and now, and actually we'll talk more about miscarriage and things I'm bringing that space. But when you are going through an infertility journey, it is your journey, and you're not made to feel like whatever you're feeling is okay. So if as desperate as I was, not having ever experienced the pain of a miscarriage, I was just desperate to know that my body could do what it was supposed to do. And I would like to just know that I could get pregnant once, that it wasn't just an inhospitable cavern of wine.
I know, but here's my thing now that I look at, and someone's going to say, listen, I've been talking about this now for Jane is 20 and a half. So I've been talking about this for 20 years now. So I know the negative comments that would come from people. My body did exactly what it was supposed to do. I was exactly supposed to end up with them. My last miscarriage took me to Jane. If I hadn't had it, I would have adopted sooner. I wouldn't have gotten matched with Jane's birth mother. She wouldn't have picked me. My timing would have been off for Jane. In the moment, yeah, my body's failing. First of all, it cost me $82,000. That it will always be painful. But and then help us adopt. And then Brooke, like I sit here and I'm like, oh my God, I thought this was the worst thing that ever happened and my body failed, but maybe it did exactly what it was
Well,
supposed to do and sent me where I was supposed to go.
we're talking about 2 different viewpoints. One is at the beginning of the journey,
Yeah.
and the other's at the other end. And somebody asked me, I mean, I was mentoring this young woman, and she said, "How do you get a story like yours that leads you to where you are?" And I said that you don't start out planning the story. The story is what happened. And we just filmed a video for my company recently where I said, nobody starts out by saying, let me fail 7 rounds of IVF so that I can go co-found a women's healthcare company. That's the end product of using your story to create something new and better, which is what we both did. And yes, my story was meant to happen exactly the way it happened. But in the moment, you don't know what's going to happen. You don't know that you're going to have a happy ending. You don't know why this is happening. And my 4th one, as I was saying, I Googled adoption, blah, blah, blah. And I read something that said, if you're thinking of adopting because you've heard that's how some couples just get pregnant, that's a bad reason.
Yeah.
And I was like, called me out, didn't you? But then a couple more cycles, and I shifted from wanting to be pregnant to wanting to be a mother. That was a huge internal shift. And once I wanted to be a mother, that became the focus. For so long, the focus was getting pregnant. When you shift to, I want to be a mother and I want a child, you want that child in your life that day. It helped me pivot to where, nope, this is what we're going to do. And that fear lessened. And by the time she was born, I was just grateful. I was grateful that she was very small on ultrasound. They'd said she was going to be 3.5 pounds. I thought, oh God, my bigger fear was, as a pediatrician, I know what a preterm growth retardation baby, the NICU, the infections, the tubes, the lights, I didn't want that. I was worried about that. I was worried about her health. And when she came out, she was 4 pounds 10. I was like, woohoo. And then I got to the nursery and the nurse said, feed her. And I said, I'm a doctor. I write orders for you to feed her. I don't know how to feed a baby this small.
Funny.
So she's like, okay, well, you're going to have to use the littlest nipple. And I didn't know anything about taking care of a baby that small. They normally keep them in hospital until they're like 5 pounds something. But babies for adoption, they want them out. And they're like, you're a pediatrician, so take her. And at 48 hours, I was walking out the door with my 5 pound. Now she got up to 4.
You know what's funny? I always say to people, like, I know you were saying a little tiny baby, but a lot of people, I had experience with babies. I was the oldest of 5 kids. I don't even know how many cousins and aunts and uncles, and I was the oldest. So I babysat relatives forever. Saw a baby, I'd pick it up in one arm and like make their dinner with you. Like at 18, I was doing that. Like, so for me, getting handed a baby was like handing me whatever.
Well,
And
had she
there's
been normal size,
but
had
don't
she
you
been
think?
normal size,
But
I would
did
have been like, this is every day.
I know, but
This is my
when she
work.
went into your arm, wasn't that fine? Didn't you have a moment where it was like, oh, it's the same. She's just tiny.
No, the moment was because I was worried because she was delivered early so she was preterm, not by a huge amount, but earlier than we thought because she had an ultrasound fluid around her heart, which could be a sign of fetal distress and baby could be dying if you don't get her out. So sometimes baby's healthier outside than in. I'd gotten a phone call. We were in New York at the time. She was being born in Florida. My lawyer had called and said, baby has pericardial effusion. Get to Florida now. And I panicked because I'm a catastrophizer I'm an emergency room pediatrician. I know all
You know
those
too
things
much.
that
You know too
I know
much.
too much. So I go tearing down to Florida. My mother was with her father, who was literally dying. He died 2 days later. He died the day that her birth mom signed her over to us. So that's 24 hours, right? And my mom was like, your sister has to come. But my sister had a 6-month-old. Her dad was in Europe. He had to jump on a plane. So there was so much more for me to worry about than am I going to be able to take care of this baby? It was more like, is she going to be premature? Is she going to have a cardiac issue? Is she going to be born alive? How long is she going to have to stay in the hospital, right? The moment for me where I realized it was all going to be fine was when she was delivered and they handed her to me and she was so much bigger. And I handed her to her birth mom to get a photo. I gave her to my mom who had arrived, told her dad, Lara's having a baby. I need to go. And he squeezed her hand and she left and came with me. And then it was like when the nurse handed, and it wasn't I didn't know how to feed a baby. I do not, I also knew a lot about babies, but a tiny baby in it wasn't something that a pediatrician, like, you don't sit there and rock the cute babies. You write orders and run around the room. And she
So
said, feed it. And like, I don't know how to get the nipple in her mouth. And literally her mouth, her head
That's
was the size of a
hilarious.
tangerine.
It's sort of funny. I mean, honestly, not that the head was the size of a tangerine, that you're like sitting here, this brilliant overachiever doctor, and this is like your challenging moment.
But I figured it out. And then
It makes
you
us all feel
fail.
human. Thank you. Makes us
Well,
all
you're
feel
welcome.
human.
And I think all of us, I thought I was going to ace this mom thing because, I am a pediatrician. What do I need to know? No, I would say one of the low points was when I ordered the preemie diapers on Amazon and they sent them in bulk and I was not going to waste diapers. So when she was 3 months old and
God.
fully fattened up, my mother went to change her and started screaming because there were red marks all over her legs because I was like, we're using the last of.
Oh my God.
And then that
No,
was the
you
same
could have
thing.
donated them. You could have donated.
I know, but I wasn't thinking because I was expecting another baby, and that was the
Yeah.
same day I used scissors to cut her out of her onesie because the poo was going up her back.
Oh
and
my
I didn't.
God.
I
So
just
lovely.
couldn't.
Those are
couldn't
good
do-
moments. Those are good moments. We talk
Right?
about these. We remind them when they're grouchy teenagers what we had to do.
That's
Um,
right.
we have to shift. I mean, we could talk about this all
Oh
day.
God,
We'll
we
have
could
you
talk all
back, but
day.
we have to shift. I went through my hell. I came out of it in one piece, decided to go back in the fire because I saw a problem that I actually thought I could solve or make a difference towards solving, which is helpusadopt.org. You went through the fire, you came through it, and then you were like, for those of you who don't know, there's a lot of invasive drugs that you have to take while trying to become a mom if it is challenging for you. Painful injections that I think my hips are still sore from 24 years later. Needles 3 inches long, the size of a pencil lead, in order to get it in the muscle properly. You have no other choice. You just do it. That's how badly you want to become a mother. But you looked at all of this and said, I'm going to start a company. I'm going to go raise money because there has to be a better way. And let's shift to what you're doing now and tell.
So what you're talking about is progesterone and oil, and progesterone is used to support implantation of an embryo. It's used across the board for infertility treatments, recurrent miscarriage patients, etc. In the US in particular, it's most often given in a very painful injection into the muscle. Less so outside the US. In the rest of the world, there's a tendency to give it vaginally, but those products leak and women are told to lie down for 30 to 60 minutes with every dose. So in some places, they then jump to the injected just to be sure you're getting the dose, right? If it's leaky and you have to lie down, because women have all this time in the world. Like I have hours a day, every day that I lie down watching soaps. So
Well, you did get the sling to watch
I did get the slingshot,
Days
but
of Our Lives.
this is true. Called out.
But
So-
it is
so
true.
I am
like,
now-
people just assume. Listen, even if you are a homemaker with no children, you don't have time to lie down like that. Like,
But even if you do have time to lie down, the fact that you put a drug that's supposed to be supporting an early pregnancy into your vagina or your rectum and it leaks and you don't and guess what also you start to have leakage and discharge if you're miscarrying. So for recurrent miscarriage and infertility patients, leaky vaginal drugs are very emotionally upsetting and you end up jumping to these painful injections. My company, I wound up sort of accidentally co-founding a vaginal drug delivery platform company. We are UK based. We take any drug, and you'd be shocked at how many drugs can be given vaginally. We take any drug, we incorporate it into our device so that we deliver just drug and we absorb all the icky bits and all the leakage, and you don't have to lie down. And we are starting first with progesterone. We are being fast tracked through the UK regulatory body. And we are now clinical stage. And at the end of this safety study, we will do our bioequivalence at the end of the year. And after that, hopefully, we will sometime mid next year be the world's first approved miscarriage prevention drug device.
it's pretty
And
impressive.
that
I mean,
is
this is a word, miscarriage, forget vagina, miscarriage. Miscarriage seems to upset people more than vagina. That is a technical term for a body part of a woman. And what, half the population is female? Like, come on. Why are these words? So you can't say that, Becky. You can't. But miscarriage, do you know how many? I mean, I don't have to ask you that question.
so
You don't have to be infertile to be dealing with miscarriage. Like, oh
No.
my God, they happened every day.
And there was a study that Tommy's, the birth charity in the UK, think of it like the UK March of Dimes. They just released a study showing after one miscarriage, yes, there's a negative effect on a woman's mental health. After two, there's a turning point. And after three, there's a significant decline in her quality of life measurement scores because of the trauma. So I'm actually an investor in a company called Sybil, my great friend Melissa, who is using her own pain to develop a miscarriage support app for pregnancy loss, because when she miscarried, she had her little pregnancy app, right? And she types in lost the pregnancy and it just goes black. And a couple weeks later says, are you ovulating? Where was the support? Where was the room to grieve the loss of something that was so exciting? So there's a lot of people working on this space, and I've learned so much just being in this space. But I think that, like you, taking your story and doing something to make it better for just one other woman, one other person and I think we also forget the men in this process.
No one wants to talk about the men. I mean,
No one wants to talk about the men. No, and nobody wants to give them a space to grieve, yet all men do come out of a woman. I hate to break it to you.
That's a whole nother podcast. So as this female founder of Calla Lily, besides you're creating this service, just drug, I don't know what you call it. What do you call it? System? Delivery
It's a
system?
vaginal drug delivery platform. It's called Calla Lily.
Okay. You're developing that, which is going to change lives. But as a female, what do you think your largest role here is?
It's to be a voice, because I come at this, I'm highly overeducated. I have a doctorate. I have 2 masters. I'm 54 and a half. I've got teenagers. I want women to have choices. I want them to have choices about whether they choose to go through fertility or not. And if they do, I want that experience to be as positive as it can be. I want women to have choices. I share my story very openly about my children being as related to each other as a band of chimps and they look weirdly alike, because it's important to me that my adopted children don't ever feel like that wasn't as valid a choice for any family to be built in this way. I don't want to ever have somebody say to me, I can't have children because I can't afford it, or because I can't stand the medications, or because my family is going to think something of me. And if somebody says to me, I had friends who went on holiday with me and my kids, and they literally canceled their adoption midway through that week. Yay for me. But they looked at me and they're like, these kids are normal. And they're like, we're going white sofa. And I'm like, you know what? If your choice is white sofas, God bless you. because you had a choice. And what breaks my heart is people who feel like they cannot be a parent if they want to be. In the same breath, if you go down that road and you decide you'll be somebody who contributes to society in a different way, or you'll surround yourself with children that you support in a different way, or mentoring or teaching. I just want people to have choices that
That's it.
respect who they are as
And
people.
I talk a lot. I have a lot of, it's a growing number because I'm almost 56. It's a growing number of women I meet who have chosen not to have children on purpose. And I think they deserve a round of applause because the world will also tell them that's not okay. That's not normal. Of course, you wanted a kid. And it's so terrible that these women's decisions, which they stand by, aren't honored. Come on. Come on. And they love the role they play as an aunt or an uncle or a godmother or whatever. And aunt and uncle, did you hear me say that? Women are not uncles. Yes, I know that. But the world doesn't tell you that's okay either. So the world will tell you you're not supposed to do this. The world will tell you you're having babies too late. We couldn't do it. Or the world needs to stop and get a new narrative about what becoming a parent really is, and all the choices available and all the help that's out there to support people. I want to talk to your friend Melissa too. You're going to have to introduce me to her.
I will introduce you to her.
Because
No, I think
there's
you
help,
do
there's
is
support.
there's support, and part of it is talking, like what we're doing here. Part of it is saying the words. Like, I say vagina a lot because that's what I do for a job. But the other night,
I say adoption a lot. My kids hate it.
Right.
They're
Well,
like, really?
we-
Again, you're going to tell us?
we had a robust conversation at dinner the other night about a duck vagina because it's corkscrew shaped to help the duck choose which duck man can impregnate. We're like, oh no, I just bring it home. And my kids are part of that story, so they don't love the vagina at the dinner table conversation,
Right.
but they do know, as your kids, your girls know, they are part of my story, and
Yeah.
they're why I'm working
Yeah.
so hard to change it and make it better for other
Well,
people.
and as I tell people, you think the infertility rate was bad with our generation? All this work we're doing now is for the next generation because I meet young women who are in their 20s, graduating from college, who tell me that the message is, and at good schools, like really good, accomplished schools, the message they're being given is you have to pick one. You either get married and have a baby right away or you have a career, you can't have both. Well, oh my God, that is
I
horrible. Then why
I
did you
just
go to college? Why did you
no.
just spend $250,000 on an education that, and guess what
Do you
they
wanna hear
say? I'm like, oh my God, we're back
no.
in the medieval dark ages.
Worse, I just talked to somebody who said her job was offering to pay for her egg freezing. And I'm like, you should leave a job that tells you need to freeze your eggs if you plan on succeeding in this company.
Yes. And
But that's
I'm at
another
more,
topic for another
I'm
time.
at more with the, and I am not anti egg freezing. I believe in it if a woman makes this choice on her own. What I am against is the new messaging telling teenagers, 13, 12, 11, 12, 13-year-old girls, when you're 18, you should freeze your eggs. So we're telling these girls, first of all, not to be girls, to be grown-ups and start thinking about this. We're also telling them you're only as good as your fertility. Are you kidding? That's what we're telling these little girls who should be playing with Barbies and going to movies.
But you know,
We're going to tell them to worry about their fertility. Holy crap, that's terrible messaging.
you know, there's 5 kids on the planet that I can name right now who don't think that, because one of them is like, I'm never giving birth. I'm only adopting because that sounds disgusting. And I'm like, great.
Well, I have one of those, and I have one who says, I don't think it's for me because she sees it's hard work being a parent. It's all in being a parent. And they see me when things go wrong, diving in without asking any questions and no life vest. And she's like, I don't know that I want to do that. But that's what you have to be as a parent. That's it. That's the rule book. And who knows? But I don't want my girls to ever think, or any child out there, female or male, you're only, are we telling young boys to freeze their sperm? What are we doing about that? I think it should be an
No.
equal opportunity thing here. Let's start telling, what is that? Girls need to be girls. And if you want to freeze your eggs, by all means, go for it. But this, first of all, it's also privilege. That's my other argument.
That's
Most of the world can't even begin. So if you're going to make the global messaging to teenage girls that they need to freeze their eggs when they turn, how many of them can't even afford it? Now why don't you just kick them in the face? What's going on?
because that is assault, and you can't do that.
Thank you. Okay. I'll get emails about that too. But this is it. All right. Ready? We have like 2 seconds for one last comment from you. And it can't be the word vagina or rectal delivery. Pick a new word.
Colonoscopy?
That's for a different show about our age box. What do you want the world to know? Where can they find you? If they want to read up about this groundbreaking research you've done and testing you're doing, like, how do they find you? How
You
can
find
they?
me everywhere because my job is to run around the world flapping my arms and getting attention. You can find me at larazibners.com. That's right. You can find me on LinkedIn. I'm on Instagram as Dr. Lara Zibners. I have my own podcast called Unstable Vitals with my business school professor who also wants to be a comedian. And you can read about it at Calla Lily Clinical Care. You'll find our website. But I guess my final message is thank you for being you, who has taught me so much about the importance of being both judgmental and non-judgmental at the same time.
That's it. And when you see something that's wrong, make a good suggestion on how it can get. Don't just complain.
That's right.
Offer a solution. And if you really care, dive in and create the solution.
That's right.
Yeah, it's pretty incredible. 30 Seconds with Becky Fawcett. You know, I never know what I'm going to say for this. It's not planned out. And this last podcast with Lara Zibners, there's a lot here. I think the most important thing is that she said something about clearing your path and how at the beginning of both of our fertility journeys, as difficult as they were, by the end, you have a different perspective. And it's sort of great and not great. You wish you had that perspective at the beginning. It would have been easier. But in my brain, I don't think everybody also gets that perspective at the end. I think you have to want that perspective at the end. I think you have to say, why is this happening to me? What am I learning? And where is it taking me? Where am I going? Otherwise, you could sit around and just like, oh my God, that sucked. My life sucks. And it was that bad. You could also come up with some other descriptors. But every time, even today in my life, when things get really, really hard and really, really shitty, why is this happening? What is it trying to teach me? What am I going to take away from it? And where am I going to go? And in the case of my case and Lara's case, we decided to become agents of change to fix a problem that we saw out there in our own stories. And that's why she founded Calla Lily and why I founded helpusadopt.org. It's a little extreme to found an organization, but that was what I wanted to do and was capable of doing. Your story might be a little different, but I'm telling you, every time it gets really shitty, don't just sit there and complain. Try to find the glimmer, because there's a glimmer. It really sucks. I get it. But why is it happening? What is it trying to teach me? And where am I going with it? 30 Seconds with Becky Fawcett. I have to close out and thank everybody for tuning in today. And here's the deal. All I care about when people hear the topic I'm presenting on this podcast, or me talking or you talking, I hope you now see the world a little differently and maybe use your voice to stand up for someone. Stick your neck out, share an opinion of something that could actually support someone and make a change. Maybe a tiny one. That would be great. You can find me on Instagram, Facebook, and YouTube, and I think I'm on TikTok. I've started posting videos on TikTok. You can message me. I will message you back as long as it's not mean. It's actually me, just like Lara said. I pick up the phone, I message back. If you're mean, we're done. It's not happening. And I might screenshot you and post you if you're mean. So there's that. Helpusadopt.org. We are making adoption financially possible for all. I think you're on to something great. I can't wait till next year. I hope there's a launch party in New York. I will help you however I can. Thank you for being you.